Was it harder to go there or harder to come back?
It was definitely harder to come back. I never thought I'd be saying this, but it was harder to come back. And I felt guilty because I need to be there helping them.
The there Canadian eye surgeon Dr. Yasser Khan talks of is this place, the pummeled Khan Younis in Gaza, a city under siege, and within it, the overwhelmed European hospital. He's treated plenty of war wounds around the world, but Gaza was his first active war zone. He got less than a day's notice that he was on a list to be allowed in. That road to Rafah,
Here's more trucks.
teeming with aid trucks, some frustratingly stuck.
And we're just gonna stop off.
And once at the border, the process took so long, daylight slipped away.
It's a UN policy that nobody travels after 5 p.m. because there is indiscriminate bombing by the Israeli forces. So there is cars being driven, ambulances are sometimes attacked by missiles. So you never know what's going to get attacked and what's not. And so we drove for about 15, 20 minutes. It was dark. We were the only car on the road. And those 20 minutes were really long. I actually made peace with myself, with my family, with God, asked for forgiveness.
So you walk into the hospital, and what hits you right away?
The chaos, the drones humming around, the bombs dropping, and the chaos. It was just mass chaos. On the floor, they're often sleeping on mats or carpets or sheets or on the floor directly, and that's all around. When you enter the hospital, every hallway of the hospital is lined with these shelters.
When and where he could, he shot video, took stills, tried to chronicle the reality of what felt so unreal. One of the few functioning hospitals, he soon learned. Thousands taking shelter there, desperate for safety, dignity, too much to hope for.
He has 20,000 people of living in and out, one bathroom for about 200 people. Riots break out over bathroom use.
As in, like, spending too much time there? Or?
Exactly.
And people are unwell, so
People are unwell. So that's the other thing, is that everybody's coughing. Everybody had that Gaza cough, respiratory disease. There's gastrointestinal illnesses. People are sleeping outside. So there's disease everywhere, but there's shortage of antibiotics, painkiller. They put up with the pain. They will put up because there's no other choice. So they're on the floor because there's no beds, and they're just lying there getting infected, right? Because wounds get infected, and it's not a clean scenario. Infection rates are high, and they're in pain, but you gotta live with it.
What do you wish you'd brought with you?
I wish I'd brought more instruments because their instruments are old and they've been overused the last 3 months. And small things, there's no chocolate. And not candies for the kids. And there's so many children, Adrienne, just running around, and there's no coffee left. So they're always asking foreigners, do you have any coffee? Do you have any coffee?
From these impressions, you might get the sense that Dr. Khan was in Gaza for weeks, maybe a month. But it was barely 8 days. Time moves differently when you're afraid and overwhelmed. And shattered eyes and faces more than overwhelmed.
One thing that really struck out to me was what I call now the shrapnel face. When there's an explosion, you don't go like this because you don't know what's happening. And so the shrapnel, whether it's steel and concrete and wood and dust, just comes and attacks your face. This is the classic Gaza face that I saw. I saw so much of this.
Who's this little guy?
He must have been about an 11-year-old boy. Who, again, there's a classic shrapnel face. These are all shrapnel kind of injuries on all these red dots. Sometimes it's both sides.
Behind each angry-looking red mark, debris driven into the skin that has to be removed. And in the case of tiny 6-year-old Aseel,
Her father, I think, was gone.
he had to take out her eye. He performed dozens of surgeries like that, often on children in Gaza. In Aseel's case, the blast was so severe, something terrible hit her just under her eyebrow. It was this. This rock was embedded in her eye. He can't stop thinking about what happens now for her, for all of them.
Burned her hair, too.
Burnt her hair, and she was all covered with dust. I don't know if you can tell, maybe you can't, but all dust, because she was pulled from the rubble.
How much pain relief is there for her at this?
There's no pain relief for her, to be honest. I don't know how to take it. any medical issues.
The thing about being a helper,
Any black curtain coming.
even as someone now back working with patients in Canada, is that he's still invested in those he left behind. When you hear of the terrible toll in Gaza, you hear the numbers of dead. But there are tens of thousands of profoundly wounded people whose lives would be rough in the best of circumstances. So imagine them in Gaza. All those faces swirl in Dr. Khan's head.
All 5 of your senses are activated and are in hyperdrive. The smell of blood, the smell of dust, the screams. You hear screams and mass chaos, like just massive chaos. If people running around, babies left on the floor because there's no beds. One baby got forgotten for 2 hours, and the baby had a subdural hematoma and massive head trauma.
What happened to the baby on the floor?
They finally discover the baby. The mom's not there because she's up in the OR. He was taken to the neurosurgical ward. Thank God neurosurgery made space for the baby because they were full. And we had to leave. I don't know what happened to the baby. The mother also, they operated on her. They amputated one leg. And then she was in ICU, but we had to leave.
Had to leave as in had to leave Gaza. The window to get out was closing. The job, as he saw it, far from done. But the risk was getting stuck. And getting out was as unnerving as getting in. Add exhaustion to the fear, and it's a lot. And he wants to share what he saw out of another fear, that people will forget.
I had a feeling, a sense of feeling when I was there, Adrienne, that these are people that humanity has really abandoned. Mm-hmm. When you've seen the suffering that I did, you know what? Everything else is a blessing. And I came back almost numb.
You'll be back?
In a heartbeat, I'd go back to help. Yeah.
Dr. Khan, thank you.
Thank you so much.
Really appreciate that.
Thank you.